So, yes, students. Okay, so welcome to our discussion of NEET 2026 paper discussion. And today we are going to discuss about the first six subjects alone. First six subjects alone. Okay, probably by tomorrow we'll be discussing the remaining subjects. Okay, and the discussion will be useful for if any 2027 students are attending the session. Okay, it is very much useful because you know the pattern of the exam, how the examiners are asking the question in recent days. Okay, right. So what is like superficial learning doesn't help for hereafter for NEET MDS exam. Each question is analyzing based question actually. And if you see this, okay, I'm going to discuss about the first six subjects. Okay, among the six subjects, almost 90% of the questions are like using your not a straightforward question. Okay, so that is what I just wanted to convey. Yes, students. So without any delay, go for the discussion part. Okay. So first question. Okay. First question. Yes, the question is about the patient who had an experienced status epilepticus, right? So always the questions from the status epilepticus and the status asthmaticus is very important. So basically, without I'm just not going to tell only the answer. I'm just going to discuss the related points also. Probably it will be useful for your initiate exam preparation, or if you are a student for 2027, it will definitely helps for you, right? So what is called a status epilepticus? Status epilepticus is the epilepsy which is not controlled by the drugs. Okay, I mean normal drugs. Okay, which is called as the status epilepticus, uncontrolled epilepsy. Simply, it is called as the status epilepticus. And what is the drug of choice for the status epilepticus? Even though they given a line okay, for this, the key point is the only key point is status epilepticus. Always when they give paragraph based question, your eyes should go towards the key point. If you study the whole paragraph, you won't get time. So time management is also very important. So keep on practicing for this type of paragraph based question and checking the key points. Okay. So the 1 year of preparation, you have to be prepared and you have to be workout. Okay, both are important. Workout means you have to write a lot of tests. Okay, right. So coming back to this, so status epilepticus is the question. What is the drug of choice? Obviously, the answer is lorasiform is the answer. Lorasiform. What is the route of administration? Is maybe asked in your NCET exam or 2027 exam. So lorasiform, the route of administration is IV. So whenever remember, if there is an emergency condition, you have to give it in the IV format, except for anaphylactic shock. Okay, we won't give it given in the IV format, right? Apart from, what are the other related points which you should know related to this epilepsy? Okay, what is the drug of choice for all the type of epilepsy like the tonic epilepsy, clonic epilepsy, tonic-clonic epilepsy, all the type of epilepsy, what is the drug of choice? This is the answer. Okay, valproate. Valproate is the drug of choice for most of the type of epilepsy. Okay, valproate, most of the types. Okay, except, can you give some exception? Can you give some exception? Can you give some exception? Partial thesis. Okay, very good. Partial thesis. Partial thesis, what is the drug of choice? The partial thesis, the drug of choice is carbamazepine. Okay, yes. This is one exception. Okay, yes. So coming to the next part. Okay, so this is again here the paragraph based question. What is the key point actually? The key point is yes, the farmer is the key point. Usually, farmers are exposed to what type of poisoning? Organophosphorus poisoning. Those days when we prepared for our NEET exam, I mean, that is we don't have NEET exam, all India exam. Okay, simply this question, if the question is asked for us, how the question will be asked? Simply they asked us, what is the drug of choice for organophosphorus poisoning? This is the question 10 years back. But now we don't have any single question like that. This question is about organophosphorus poisoning only, but it is not a straightforward question. But how do you know whether it is an organophosphorus poisoning? Okay, the key point is farmer, you should be exposed to organophosphorus poisoning. Usually the patient has an organophosphorus. Organophosphorus is nothing but insecticides. If the patients are exposed to the insecticide, So the cholinergic symptoms are more. Okay, whenever I am talking about cholinergic, what does that mean? Whenever I'm talking about cholinergics, it is nothing but parasympathetic. Parasympathetic increase the secretion. Whatever the tear secretion, lacrimal secretion, salivary secretion, gastric secretion, every secretion in the body is increased by the parasympathetic system. So insecticides usually increase this. So that is why the patient has salivation, okay, diarrhea because of the secretion, increased lacrimation. But what about the heart? Okay, so heart usually cholinergics is a parasympathetic. Parasympathetic decrease the heart rate. Parasympathetic decrease the heart rate. So heart rate is less. Heart rate is just a 48 beats per minute. So heart rate. Okay, this is about the parasympathetic. Whenever I'm talking about sympathetic, it is just exactly opposite. Okay. But what is the sympathetic? Sympathetic. So cholinergics are parasympathetic. Yes, decrease the heart rate. What about sympathetic? Sympathetic increase the heart rate. It increases the heart rate, it contracts the heart. All the other organ, it produces relaxation. All the other organ, it produces relaxation. Okay, just coming to the parasympathetic, all the other organ, it produces contraction. Only heart, it causes relaxation. That is why heart rate is reduced. Students able to follow me? Yes. And is able to manage. So the two category of students are there here. So one who is an expertise, so completed the recent exam. The other, there are few students from 2027 batch also, so I have to balance both of them. Okay. So in case if you're not able to understand anything, okay, or the points are not enough, please give me the message in the chat box. We'll be repeating this part. Okay. Yes, students, clear? So there are two things which is called parasympathetic and sympathetic. So parasympathetic, which actually causes contraction of the all organ except heart, it causes relaxation. Sympathetic is doing opposite. Okay. So since the patient has a increased cholinergic, okay, but what is the anticholinergic drug you can give for the patient? So usually the anticholinergic drug which is given for the organophosphorus poisoning is atropine. Atropine is the drug of choice for organophosphorus poisoning. Straightforward question. Okay, but since it is given in the symptoms, you can easily relate this with an organophosphorus poisoning. What about naloxone, students? Naloxone. Whenever you see about the naloxone, there's nothing but, excuse me, drug of choice for opioid poisoning. Yes, drug of choice for opioid poisoning is naloxone. Yes, Yamini good, Shreya good. Yes. So coming to the next part, students. So third question. Yes, the question is about super question, nice question. Actually, again, application based question. So the patient, the child, especially child, see the age of the child, which is 6 year old. So they given the antipyretic. Okay, antipyretic means reduce the fever. During the influenza, student, this is the third key point. Okay, influenza is a viral infection. Yes, develops a hepatic encephalopathy. It's the very important key point. Abdominal pain, behavioral change, which drug causes this? Very simple, students. If a child, what is the NSAID which is usually we won't give, especially when the child has some viral infection. Okay. So yes, answer is aspirin. Because when you give aspirin for the children, it causes a syndrome called as Ray syndrome. Causes a syndrome called as Ray syndrome. So that is why the answer for this is aspirin. Okay. Many students actually made a mistake. By seeing this hepatic encephalopathy, they went for paracetamol or acetaminophen. Actually, here the age is the key point. Age is the key point. Yes. So paracetamol which also causes the liver toxicity. But the key point is here age, influenza related. Okay, so it is a racing. Okay, yes, students, clear. Yes, coming to the next part. Okay, yes. So this is again one more very good question. Okay, every question is easy question only. But yes, you have to think a little bit. Okay. The post-operative patient on analgesic develops severe nausea and acidity and constipation. So key points are analgesic, constipation. Which drug is responsible, right? So all the four options are analgesics. Okay, all the four options are analgesics. So which option I can go for is what is the next key point? The next key point is the constipation. So which are the following drug causes constipation? Yes. Okay, answer is what? Codeine. Codeine is the answer. Why codeine? Because codeine is belongs to the opioids. Opioids. Codeine belongs to the opioids. Usually opioids causes what? Opioids causes constipation. Yes. So that is why we go for. Otherwise, even if you doesn't know the concept of opioids causes constipation, okay, you can take a risk. Okay, by eliminating the other option, and you can go for codeine. How? Because celecoxib, ibuprofen, acetaminophen, all the three are the NSAID category. The one odd man out is codeine. So by this point also, you can eliminate and you can easily derive the answer of codeine. The students clear as so if anybody have doubt, please message me in the chat box. I will be here, happy to help you. Yes. So question number 5. Yes, students. So this is actually a image-based question. Okay, but the image is missing here. So there is a case which there is simply the image is nothing but gingival enlargement. Okay, most of the image-based question, the image is actually not needed. Simply to make you. Sorry for it. Yes. No, no, no. Rainak, I am here only. Okay. Yes. Okay. We just started meeting just now. Okay. How I can end it. Okay. Yes. So, renal transplantation. And most of the cases, image based question actually, image is not needed. Okay. So, simply to panic you, they added images. Okay. நாங்களாம் பயப்பட மாட்டோம் அப்படின்னு சொல்லிட்டு தைரியமா எக்ஸாம் எழுதுனீங்கன்னா you will get a very good mark. Okay. So, yes, a renal transplant patient with ginger enlargement is which covering the 2/3 of the mandibular incisor. Which drug is responsible? Yes, very, very simple, easy question. Okay, and if you see this all the 4 options, which of the drug causes gingival enlargement? Okay, steroid doesn't cause, sulfonamide doesn't cause. Okay, you have 2 options, cyclosporine or nifedipine. Nifedipine is belongs to the calcium channel blockers. But since actually patient had a renal transplant, whenever after the transplantation happened, usually the patient will take some immunosuppressant. Okay, the immunosuppressant the patient takes. Okay, the preferable choice is cyclosporine. Obviously, cyclosporine which causes gingival enlargement. Yes, yeah, exactly. Okay, so cyclosporine is the answer. Okay, but so to avoid the cyclosporine, what is the drug of choice? What is the drug of choice for the replacement of the cyclosporine? Come on, yes. Okay, this is also very important question. What is the alternative? The alternative is tacrolimus. Yes, tacrolimus. What is the alternative for the nifedipine? Yamini good. What is the alternative for the nifedipine? Yes. The alternative for the nifedipine is isradipine. If you want to avoid the gingival overgrowth caused by the nifedipine, you can give the isradipine. Yes. Good. So coming to the next question, very, very super question. Nice question actually. Okay, yes. The patient is actually planning for dialysis. Okay, dialysis. Which property a drug most available to remove by the hemodialysis? Very good question, students. Very good concept actually. I like this question very much. Okay, right. So this is a question. Okay, which say about which patient is more good for hemodialysis. Okay, right. Let's see about the concept of VD. So what is called VD, students? VD means volume of distribution. VD means what? Volume of distribution. Right. Very simple, students. Okay, when you take a drug, okay, you take a drug. Okay, the drug goes to the GIT. From the GIT, it goes to the blood. Okay. So what is this? This process is called whatever the amount of drug absorbed from the GIT and goes to the blood is called as anybody goes to the blood is called as come on. Yes, bioavailability. Yes. So please, okay, any students available, right? Who recently appeared for the exam, please give the answer. Okay, bioavailability. Yes. stay good. So the blood reaches the drug reaches the blood. From the blood, the drug goes to the tissue. From the blood, the drug goes to the tissue. What is this is called as? This is called as VD, volume of distribution. This is called as VD, volume of distribution. Students, what is called volume of distribution? Very, very simple. The volume of distribution, the concept is volume of distribution is the amount of drug reaches the tissue is called as the volume of distribution. Yes. So now I want to do hemolysis to remove some drug actually to the blood. Okay, so simple logic. Okay, if a drug has high volume of distribution, obviously the drug which is present in where? Present in tissue. Because what is called volume of distribution? Whatever the drug which is the tissue is called as the volume of distribution. If a drug which has a high volume of distribution, the drug is present in the tissue. Students clear? Yes. Okay, right. Upper. So the drug which I wanted to remove it, okay, should have less volume of distribution. Then only the drug will stay in the blood. So only if the drug is present in the blood, it is effective in the dialysis, hemodialysis, right? Dialysis is just a purification of the blood. Only if the drug is present in the blood, I can able to do the purification process. Yes. So a drug should have low volume of distribution. Among the four options, the only one option which has the low volume of distribution is the first option. You can easily derive the answer if you know the concept, students. Okay. Students, clear? Is shall I go to the move on to the next question? Yes, again, a very super question. Actually, we discussed this question almost more than 100 times. Okay, in the center. Okay, yes, levodopa is combined with the carbidopa in Parkinsonism. What is the rationale? Why I wanted to add levodopa with the carbidopa? Yes, usually for a patient of Parkinsonism, I will be given levodopa. For the Parkinsonism, I will be given the levodopa. Okay, yes. So the levodopa, okay, which reaches the brain, okay, and the levodopa is converted into dopamine. This is what brain needs. Parkinson's patient needs dopamine. Okay, for treating the Parkinsonism, I'm giving the levodopa, but I enters into the brain and it is converted to dopamine. But majority of the drug, 90% of the drug, okay, simply 90% of the drug, the levodopa converted into levodopa converted into dopamine in the periphery itself. Only 10% goes to the brain. Okay, by the enzyme called as dopa decarboxylase. What is this enzyme called as? Dopa decarboxylase. Okay, this levodopa converted into dopamine by the enzyme dopa decarboxylase. Okay, I don't want the levodopa to convert it into dopamine in the periphery. I want in the brain. So to block this process, I am inhibiting this dopa decarboxylase. Okay, by giving a drug called as carbidopa. If I give it inhibits the dopa decarboxylase in the periphery. Okay, so levodopa does not convert into dopamine. Almost whatever the drug I am giving, all the levodopa which enter into the brain converted into dopamine. I need not to give much increase the dose. Okay, students, clear? Anybody have doubt in this? So the levodopa is usually combined with the carbidopa to prevent the metabolism. The levodopa in the periphery. Okay, that is the purpose. What is the answer? Answer is this A. Carbidopa prevents the peripheral conversion of the levodopa. Students, clear? Yes. Any more doubt actually? Yes. So again, very, very good question. Okay, the overall the question paper itself is so tricky paper. So tricky paper really. Okay, then and there they kept some trap question. Okay, trap the question. Okay, let's see. This is one of the question, trap question. Okay, so during the tooth extraction, your patient develops PSVT. PSVT is paroxysmal supraventricular tachycardia. How will you manage on a outpatient basis? Okay, that is a question actually. Very good question. Usually, okay, meaning this is actually old all in the question. The students have studied this question for a lot of times. Okay, okay. What is the drug of for paroxysmal supraventricular tachycardia means? Suddenly the students will tick the adenosine, they will go for the next question. But what is the trap here? The trap here is on an outpatient basis. What is the route of administration of adenosine? The route of administration of adenosine is IV route. Okay, I will for an outpatient basis, how you can give adenosine? For outpatient, the patient can go home and they cannot take IV each time. Adenosine cannot be taken in the IV, right? So adenosine is the drug of choice for paroxysmal supraventricular tachycardia, but acute condition, emergency condition. Okay, for maintaining the patient for outpatient basis, there. Okay, what is the drug is given? Answer is verapamil. Answer is verapamil. Students, it is a very, very tricky question. Okay, examiner cheated you, actually. Okay, trapped you. So by just adding this one word, by adding the one word, the examiner actually trapped you. Okay. So simply if we ask for the PSVT means we went for adenosine, but outpatient means we go for the verapamil. And what about this lignocaine? Lignocaine is usually given for this supraventricular tachycardia. Simply, not a paroxysmal supraventricular tachycardia. Yes. Student, very more doubt? Yes. This is again a very good question, actually. This is again a one image-based question. Okay, and simply, okay, the image is about the anaphylactic shock, facial swelling, and breathlessness after the IV contrast injection. Students, what is the key point here? Okay, breathlessness, facial swelling. Are the two important key points? What is the third key point? After you given some injection, the patient went for this. Whenever the patient went, okay, after injection went for the breathlessness, that means because of the bronchoconstriction. Yes, the bronchoconstriction happened by what? Bronchoconstriction is happened by the massive release of histamine. Massive release of histamine. Histamine causes bronchoconstriction. When the histamine will be released, when there is an anaphylactic shock, the histamine is released. Students, believe me, anaphylactic shock every single year. Okay, there is a question from the anaphylactic shock. Without anaphylactic shock, there is no single paper available for the last 4 years. Okay, it is a must to know topic. Was examiners whatever the examiner. Okay, the examiner may change, but the pattern of question is same actually. Anaphylactic shock is the question. Very, very, very important. In a different format they are asking. Okay. But if you understand the concept, whatever the format they ask, you can able to answer, right? So simply, if you come to derive that point, which is called in the case of the anaphylactic shock, you can take the answer easily. Okay, what is the answer? The answer is for the anaphylactic shock, you will be given the adrenaline, that is epinephrine. What is the route of administration? The route of administration is IM. Even though it is an emergency condition, you should not go for IV. This is the only exception. What is the concentration? 1:1,000, obviously. What is the total ml which will be given? 0.5. Whatever you wanted to know, everything added. Okay. So the examiner expect you as a dentist, you should know what is given, what is the route of administration, what is the concentration, what is the ml, everything the examiner wants you to know, right? So this is the answer. Okay, suppose the patient is not responsive. Okay, second time when you wanted to give the adrenaline, maybe that time you can start with IV. Okay, maybe for a second time or third time you can go for IV, not at the first time. First time is intramuscular only. When you wanted to go for IV, what is the dilution? What is the dilution? Is anybody? What is the dilution? Yes, come on, students. What is the dilution? 1:10,000. 1:10,000. Okay, not 1:1,000. It is 1:10,000. Soundarya put it. Yamini put it. Yes. Students, will I go to the next question? Okay, so coming to the next part, students, during post extraction of mandibular third molar, patient has a paresthesia of the tongue and lip. Okay, with the burning pain, which drug is effective in this case? Okay, it's a very good question again. For a burning pain, usually will be given a drug. Okay, neuropathic pain. Burning pain is nothing but neuropathic pain. For a neuropathic pain, what is the drug of choice? Okay, neuropathic pain, the drug of choice is pregabalin. Pregabalin. Yes, probably you heard about this drug. Maybe some of you in your family, okay, maybe taken this drug. Pregabalin is a very common drug. So usually it is given for the diabetic patient who has a burning sensation. Okay. Yes. So yes, students. So coming to the next point. And what is the tramadol? Tramadol, which is also used in dentistry. Okay, after extraction, the patient has a severe pain. we can give this tramadol. It is a opioid category of drug only. Yes. Which drug is used for conscious sedation via the intranasal route? This is again image based question, but image is not needed actually. Okay, for most of the question is what is the answer? Okay, which drug is given in the intranasal route? Okay, Shreya, very good Shreya, excellent. Okay, so the answer is midazolam. Midazolam is what category of drug? Midazolam is benzodiazepine. Midazolam is benzodiazepine. Okay, this midazolam, okay, benzodiazepine is usually, especially midazolam, given in the intranasal route for the conscious sedation. What is the use of the benzodiazepine? Simply, the benzodiazepine barbiturates are used for something called as sedative and hypnotics. So you have to know the difference between the sedative and hypnotic. Probably it can be asked in your next ESET exam or 2027 exam. Right, what is called sedative, students? Can you tell me what is called sedative? Anyone, please give the answer in the chat box. Please be more interactive. Yes. What is called sedative? Even if it is wrong, no issue at all. Okay. Yes, sedative means what? Yes, no. Sedative is very good. Sedative is just calms the person. Sedative is calms the person. Shreya is not actual sleep induced, just calm. Okay. Patient who has an anxiety is calm. Okay. And what is about hypnotic? Hypnotic only induces sleep. Hypnotic only induces sleep. Usually students think that sedative which causes sleep. No. Sedative calm. Hypnotics induce the sleep. Okay, both barbiturates and benzodiazepine. Okay, when you give in a smaller doses, it acts as a sedative. Little okay, moderate doses, it acts as a hypnotic. Still more, okay, increase the dose, the patient may even go for a coma, and the dose is increased, the patient may even go for a death. Simply to sleeping pills, right? Okay, for a simple understanding, right? So students, go to the next part. Okay. Is the patient on deep DVT means deep vein thrombosis. Okay, deep vein thrombosis. Okay, on heparin is patient, the patient is taking on heparin to prevent the clot formation. Okay, but the patient develops profuse bleeding. Okay, because maybe the heparin will went for a overdose. Heparin actually, okay, prevent the clot formation. So, suppose if you go for an overdose, patient may go for the profuse bleeding. Okay, what is the most appropriate drug to administer immediately? Yes, simply they are asking what is the drug of choice for heparin overdose. That is the question. Instead of asking the question directly, they are asking in the indirect way. That's it. All those questions are like this only. Okay, so what is the drug of choice for heparin? Yes. What is the drug of choice for heparin? Which is the protamine sulfate. Okay, there is one more anticoagulant which is very commonly used. That is what? Warfarin. What is the anticoagulant for warfarin? Sorry, antidote for warfarin. Antidote for warfarin is vitamin K. Okay, and heparin and warfarin is evergreen topics. Okay, so this is must to know topics. The entire part, entire heparin, entire warfarin, you should know line by line, word by word. Okay, so these are called as star topics. Okay. So probably suppose if you prepare for your NEET or your NEET exam, these topics are again commonly asked topics. So take a textbook and read entire part. Try to understand the concept. Yes, students, coming to the next part. Okay, yes, this is again one more question, students. Okay, patient failed with the heart rate of 35. Okay, Miss Liz. Okay, patient went for the secondary AV block. Due to the vasovagal syndrome, what is the most appropriate immediate pharmacological management? Yes. So patient went for the decreased heart rate. Yes, heart rate is decreased. If the heart rate is decreased, I told something related to the cholinergic also. I told heart rate is decreased. If the heart rate is decreased, I can go for the anticholinergic, right? So that time we discussed. Same concept. We can apply here also. Heart rate is decreased. So for which drug I can go for to increase the heart rate? Yes. Obviously, atropine is straightforward question. Okay. Yes. So if you are very strong in concept, nobody can stop you. Sure. Okay. So you are the king. So yes, again, the question is about competitive antagonists at the benzodiazepine. This is the key point in this question. Okay, you need not to study anything else. Competitive antagonist at the benzodiazepine. Okay, what is the benzodiazepine antagonist? Benzodiazepine antagonist is flumazenil. It is again one more topic which is very commonly asking topic. What is the duration of action of the flumazenil? Duration of action. I mean, how many minutes it will work? The flumazenil which works for 30 minutes. Flumazenil which works for 30 minutes. Yes, students, coming to the next point. Okay, next question is so again the question is about the patient who had an anesthesia was awake with eyes open, showing hallucination, delirium, involuntary movements. Which agent is responsible for this? Okay, yes. The patient has a hallucination, which is a key point. Hallucination is the key point. Hallucination, delirium, involuntary limb movement, all these are key point. What is the answer for the students? Is okay, even whether it is a ketamine, propofol, thiopentone, sevoflurane, is waiting for your answer. Yes. Yes, sir. Shreya says propofol. Okay, good. Renika. Okay. So yes. So answer is what? Awake with eye open and show hallucination, delirium, involuntary movements, which are all okay, related to the ketamine. Is she actually good? So next again, easy question only, students. Okay, simply the question is about the patient has taken the large number of iron tablets. Obviously, they are asking what is the antidote for the iron tablet. What is the antidote for the iron tablet? Is okay, desferoxamine. More than 1,000 times we studied this. Okay, whatever the question we are discussing here, everything we discussed in ardent MDS previously, actually. Okay, nothing is such a new question. So almost we discussed about how many questions are came from pharmacology. Pharmacology, you are getting almost 16 questions, good number of questions. Pharmacology is one of the ranked deciding subject option. Okay. So penicillamine. Penicillamine is usually given for the copper poison. Penicillamine is usually given for the copper poison. Yes. Okay. And any doubt in this pharmacology question? Okay, I just to clarify your doubt before I go to the next subject. Okay, students, Shreya, Sujay, very good. Thank you, students. So I just move on to the next question. Sai, just wait for 2 minutes. Yes, students, shall we go for the next paper? The next subject. The next subject is about the dental materials. Okay, let's see about the dental materials. So from the question number one, clinician wants accurate impression, multiple pores. Even after, I mean, that means what? Even after multiple pores, you can get to the accurate impression. No byproduct, voids in the cast, hydrophobic, so easy. Okay, how many key point is elastomeric impression material? Okay, which we are almost, okay, to my knowledge, we discussed more than 15, 20 times. Okay, so what are the key points actually? Okay, multiple pores, accurate impression is the first key point. No byproduct is the second key point. Voids formation is the third key point. Hydrophobic is the fourth key point. Polyether is hydrophilic. The only elastomeric impression material, only hydrophilic elastomeric impression material is polyether. Okay, everything else is hydrophobic. Okay, yes, and usually, okay, no byproduct is released and voids formation. Void formation usually see adhesive silicone. Why? Because adhesive silicone releases hydrogen gas. Hydrogen, it is not a byproduct. It will simply releases hydrogen gas. Suppose if we pour the cast, what will happen? The gases, hydrogen gases will go to the cast and create the voids. Okay. Simple question. The only impression material you have to delay the pouring. Delay the pouring is addition silicone. Srivashni, very good, excellent. Okay. So answer is what? Addition silicone. Easy question, right? So to avoid the hydrogen release, we'll be adding some catalyst. What is a catalyst? Platinum. Platinum is the catalyst. Yes, sir. So coming to the next question, students. Very good question again. Okay, yes. So what is which is true regarding soldering of austenite stainless steel? Yes. Okay, you have two types of stainless steel, which is called austenite and martensite, right? So in the austenite stainless steel, when you heat, okay, usually the stainless steel does not goes for the corrosion, does not goes for the corrosion. Okay, so why does not goes for the corrosion? Because what is present here? What is present here? Chromium is present here. The chromium which prevents the corrosion formation. Right. What is the minimum percentage of the chromium needed for the corrosion resistance? It is all in the question. Maybe the students who going for NEET exam or 2027 exam, the question may be there. Okay, right. I'm asking what is the minimum percentage of the chromium prevent the corrosion resistance? Anyone? Come on. Be interactive, please. Yes, that is very good, very good. You know the answer. Please be. Look like 12 percentage. Very good, Janet. 12 percentage is the minimum chromium. Right. But what happened when you heat the stainless steel at the temperature between the 400 to 900 degrees Celsius? Usually, this chromium level will decrease. Chromium is depleted, decreased. So obviously, when the chromium is depleted, it may lead to the corrosion. Yes. Okay. So answer is C. Right. So next question. Which statement is true about glass in the dental ceramic? Okay. Yes. Obviously, what is the answer means? Glaze is the under compressed systems due to more contraction of core ceramic. Okay. So prevents the crack propagation. So this is the concept. Okay. For the glaze in the dental ceramic. Is students clear? Yes. So okay. What is the next one? Accelerators Accelerators and retarders are added in the gypsum product. What is their effect on the strength? Okay, can you give some example for accelerator? Example for accelerators are potassium sulfate. Example for accelerators are potassium sulfate. Example for retarders are borates. Okay, accelerators. Okay, potassium is the best example. Borate is the retarder is best example. Usually we call it as ABC. ABC act as the retarder. Acetate, borate, citrate act as the retarder. Yes, the students. So these, when you add the accelerator or retarders which are act as impurities, these impurities which decreases the strength, decreases, answer is A, which decreases both the wet and dry strength. Okay. So it is act as an impurities, it actually prevents the complete block formation. In between, it just go for act as an impurities. So it decreases the both the dry strength and wet strength. And the students, what is the wet strength otherwise called as? Again, it is a very good question for NEET exam or 2027 exam. What is the wet strength is called as? Shyam, very good. Wet strength is called as green strength. Wet strength is called as green strength. Yes. So, okay. Yes, students, coming to the next question number 5. If you go for a 30 fluted carbide door or a composite restoration, what is the result? Okay, right. So, if you just go for a carbide door, okay, the key point is your flutes, number of flutes. Remember this concept. If more number of flutes are present, the cutting efficiency is decreased. More number of flutes are present, it actually decreases the cutting efficiency. Yes, students, clear? So this is the first question. Okay, 8 to 12 floated. If the flutes are 8 to 12 floated bursts are present, is usually for a cutting. 8 to 12 is for cutting. After 30 floated is used for actual smoothing or polished surface. So answer is B, smooth or polished surface. Yes. Okay, Shreya is right. So coming to the next question, students. Okay, So it is a very good question, students. Okay, excellent question. Awesome question in the dental materials part. Okay, again, this is one of the trap type of question for the students. Okay, so what exam is asking? A material viscosity decreases under pressure. The best example I can give it for you, elastic impression materials. Okay, elastomeric impression material is the best example. When you just loaded the impression material with the tray and if you give pressure, the viscosity decreases and started to flow and record the oral cavity, mean the arch, right? So material viscosity decreases under pressure. Okay, this is one. And it returns to original viscosity at rest. At rest. Okay. The question was material does not come back to the original. Okay. So actually, yes. Almost the meaning of the question is same. But the question is ditto does not actually, I don't think the ditto question. But the meaning of the question is how they asked the question is like this only actually. Okay. So is someone is telling this? Okay, very good actually. Okay, the question is about the meaning of the question is okay. This is the meaning they asked the question. Okay, it returns to the original or same some type of question actually. The term is asked. Okay. So yeah, to come back to this, returns to the original viscosity at rest. What is the property is called as? Yes. So students, clear at rest, okay, you just leave it. Okay, the material will go back to the original part. Okay, a same part. Okay, up what it is called as? Okay, it is not called as dilatant. What is called dilatant? If we give pressure and if the viscosity increases, then it is called as dilatant. Students, clear? Okay, it is not a viscoelasticity also. Okay, after you have the two things, this is where trap. Okay, what is both are actually when you give pressure, the viscosity decreases, it is called exotropic. It is called a pseudoplasticity. What I can go for? Whether I can go for exotropic or pseudoplasticity. Okay. So I don't know whether the question is same or not, but understand the concept. Okay. Maybe if you apply for any set exam or 2027 exam. What is the concept which you wanted to know for this question is if you actually are and okay, after you give it the pressure and if you just leave it, if the material come back to the original immediately, then it is called as pseudoplasticity. Okay, immediately. Okay, just to compress this, okay, the water bottle, just to compress it, and if you just leave it, the material come back to the original immediately. Okay, which is called as what? Pseudoplasticity. Right? If it is a time dependent, slowly it is coming to the original position. It's T for T. T for T. Time dependent. If it is a time dependent, it is called as exotropic. It's a concept. Okay. So based upon the question which they may ask you for in your next exam. Okay. So if you know the concept, you can able to answer. Now tell me, okay, nowhere they given immediately come back to the normal. Okay. Since it is not given the word immediately, my preferable answer is exotropic. Okay, so there are some controversy maybe yes, but my answer is exotropic part is question. Since they not mentioned about immediately, if I am an aspirant, okay, if I guide my students, so I will go for the exotropic for this particular question. Yes.
Immediately.
So
last immediately.
And most of the impression materials are exotropic material. Whenever the exam is this question, you can ask in a different manner also, different thinking also. Most of the question when they are asking, okay, so some of the they will apply the clinical based question, clinical based material based question. Okay, so which is clinically commonly used, pixotropic or pseudoplastic. Obviously, pixotropic material clinically commonly used. So the best option is pixotropic. So this way also you can answer. Okay, immediately. So that is what. Okay. So next question. Correct order of the linear contraction in elastomeric impression material. Again, a multiple times repeated question. What is the linear contraction? Yes. The linear contraction, if we compare all the elastomeric impression material, the linear contraction is highest for condensation silicone, least for the adhesive silicone. Okay, obviously, if you just do these two things, both are okay, which also looks same. Highest is condensation silicon, lowest is addition silicon. Now, go to the second and third option. Okay, so second is polysulfide, third is polyether. That means what? Linear contraction is highest with the condensation silicon. Okay, then polysulfide, polyether, addition silicon. Again, these type of questions are examined favorite area. We discussed even in the last minute discussion also. Okay, these type of questions. Which are the following is the biocompatibility issues due to their potential toxicity? Yes. Beryllium. Beryllium, which causes berylliosis. Berylliosis. It is actually, some of the patients, it may even causes carcinogen. So, beryllium is not a very good biocompatible material. Yes. Obviously, copper is not, okay. It does not cause biocompatibility issue. Palladium does not cause, it's a noble metal. Okay. So answer is beryllium. Yes. So coming to the next question. Straightforward question. Okay. So holding your resin except fast during mixing, what is the most likely reason? Okay, so resin set fast. Okay, obviously if you decrease the inhibitor, concentration of the inhibitor, obviously it's set fast, right? So answer is reduced inhibitor. It's not related to the tertiary amine. What is tertiary amine? Okay, tertiary amine is the accelerator. Tertiary amine is the accelerator. If you add more tertiary amine, that means more accelerator, speed up the reaction. Okay. So this is also okay. This is also speed up the reaction. So also the speed of the reaction is more tertiary amine accelerator. Okay, reduced to powder liquid ratio. Yeah, okay, doesn't help. Oxygen entrapment doesn't help. Yes. So, but which is the best option I can go for? Obviously, whenever, okay, whether it is an alginate or resin, okay, whatever the material, okay, to alter the setting reaction, make it fast or normal, okay, they will actually change the ratio or amount of the inhibitors. Okay. So, answer is the reduced inhibitor for this particular question. What is the inhibitor for the resin? Okay, the resin. What is the inhibitor? Yes, hydroquinone. Hydroquinone is the inhibitor. Is students clear? Yes, shall I move on to the next question? It's again very good question. A trap type of question. Okay, yes. Oxygen layer which are absorbed on the surface of the gold. What is the key point actually, students? Very important. Absorbed. It's not absorbed. There is a difference between the absorption. What is called absorption? If I take a material, okay, if the material, just pour water, okay. So if I just pour water over this material, and if the material takes the water, the water inside, it is called absorption. Okay, students clear. What is called the adsorption? If I pour a water, the water is present just on the surface, not going the depth of the material, then it is called as adsorption. Very simple. It is okay. This is the difference between the absorption and adsorption. Right. So, students, there are two types of bond actually. One which is called as physical bond and chemical bond. Physical bond and chemical bond. Usually, the physical bond is weaker. The physical bond is weaker. Yes. So chemical bond is stronger. So absorption means the bond is more, goes inside. If since it is actually retained on the surface, adsorption is weaker. Okay. Which of this bond is actually weaker means is obviously van der Waals force. Van der Waals force is a physical bond. Physical bond actually it is a weaker bond. Okay, students, clear is van der Waals force is a weaker bond. Your covalent bond, ionic bond are called as a chemical bond. Covalent bond and ionic bond are called as chemical bond. Chemical bond, okay, stronger, more stronger. Okay, this is actually a type of absorption. Chemisorption is then absorption. Since you are eliminating these three, okay, I'm just going for the remaining part which is called as van der Waals force. Students, clear? Covalent bond, ionic bond, metallic bond. These are called as primary bond. So called as primary bond, usually chemical bond in nature. Van der Waals force and the hydrogen bond is called as Van der Waals force and hydrogen bond is called as physical bond, weaker in nature. Students, yes, okay. So since they're talking about this oxygen absorption on the surface of the gold, and one more point, actually very important, students. Gold is a noble metal. Noble metal does not take oxygen. How it will take oxygen? If it takes oxygen, it will go for corrosion. Okay, anytime you heard about gold is going for rust formation, corrosion formation does not react with the gold. Gold is coming, sorry, if the oxygen is coming, oxygen will be present on the surface. Does not react with the gold. Only if it react with the gold, I can go for the chemical type of bond, like covalent or ionic bond. Okay, students, clear? Hope you understood, right? It's a very, very simple question. Anyone can answer. Okay, if you are applied for a NEET exam, can be answered for this particular question. Which component minimizes the polymerization shrinkage? Okay, what is the answer? Answer is filler. Okay. Sorry, what are the types of the filler? There are two types of filler, students. One which is called quartz and silica. Are there two types of fillers? Student answer. So those days they used quartz and it was replaced by silica. Okay, so both are the type of fillers. Okay, obviously this okay, easily eliminated. Yes. Okay, yes. So next question. Phosphate bonded investment. There are three types of investment. Gypsum bonded, phosphate bonded, and silicate bonded are the three types of investment. Okay. Phosphate bonded investment, which is used for the base metal alloys like cobalt chromium alloys. After setting reaction to burnout, the resultant chemical product is called as monoammonium phosphate. Monoammonium phosphate. So this is the answer. The students clear is. So shall I go to the next question? Yeah, very, very easy question again. Mercury and gallium is both are liquid at room temperature. This is attributed to which property? Obviously, if we take mercury, if it is present in the room temperature, obviously the melting temperature is less. That is why it is a liquid. What is the alternative for the mercury? The alternative for mercury is gallium. Gallium also available as a liquid form. Okay. So because the melting point of gallium is also less. So student, the answer is the melting point. Melting point. Yes. So this is all about your DM question. So we completed two subjects. Okay. So it's completed two subjects. So I will get back to you. Okay, at the end of the session. Okay. So pharmacology and DM is completed. We'll go for the next part, which is called endo. Right. So just a minute, students. The question is about your. Okay. The question is about in phosphate bonded investment after setting reaction burnout, what is the resultant chemical product? So is after the burnout. Okay. So what is the final product which is present in the phosphate bonded is magnesium phosphate. It's not monoammonium phosphate. Monoammonium phosphate is taken as a binder. Monoammonium phosphate is taken as a binder. But what is the final product after the burnout mix? Magnesium phosphate. So answer is D. Students, yes. Shall I go to the next question? Yes, yes, yes. Thank you. So coming to the next part, student, next subject, which is the endo part. Okay. Endo recall questions. So easy, so easy. Which among the Ellis and Derry classifications related to the avulsion of teeth is class 5? Class 5 is related to the avulsion of teeth. Class 6 is called root fracture. Class 1 and 2 is called as uncomplicated crown fracture. So this is again the next question. Radix paramolaris is located at which position? There is something called as radix paramolaris and radix entomolaris. What is radix paramolaris and entomolaris? Actually, these are some of the extra root present in the mandibular molar. The extra root is present on the mesiobuccal, it is called as paramolaris. Just opposite. Histolingual, it is called as the entomolaris. Super, yes, Shreya, Parmesh, very good, yes. So next question. Canal configuration with the presence of multiple accessory canals are called as. See, you should have, okay, so when you draw this root canal, it will be constricted in one area and it is just again it will be okay diverge. This area which is called apical constriction. The end point which is called as the apical foramen. Okay, if you just take this point alone, it is look like a flower. Okay, this is something called as a morning glory appearance. The distance between the apical constriction and apical foramen is look like a funnel shape. This funnel shape usually we call it as delta. Funnel shape usually called as the delta, apical delta. Okay. But since it is present in the apical part, okay, so I can name it as this. What is called as what? Delta. Yes, it's called as canal configuration. Is students clear? Yes, student. This is again a controversial question, which is not a principle followed in the periapical surgery. So, what is my opinion for this question? Okay, like let's go for one by one. Okay, so usually this is actually so easy to eliminate. Why? Because interproximal gingiva should be preserved. Okay, so this is the answer. I mean, correct. This is the correct answer. Okay, usually the interproximal gingiva, you won't cut down directly on the interproximal gingiva. You should not do that. Okay, it is actually for aesthetic reason. Second thing, it is a preserved for the anchor tissue. There are two reasons why you should not disturb the interproximal gingiva. So it is correct. For a mandibular incision, you will be given the vestibular incision. Correct. Okay, and vertical incision placed obtuse angle to the horizontal incision. What is called a horizontal? What is called a vertical? Right. For example, okay, if we just take your teeth, okay, like this, you will given the horizontal incision like this along the gingival sulcus. Along the gingival sulcus, you will be given the vertical horizontal incision. Vertical incision, okay, if you take your any textbook, go to the principles of surgery, periapical surgery. Okay, most of the book says your vertical should be like this. Vertical should be obtuse to the horizontal. Obtuse to the horizontal. Okay, so it is actually correct one. Okay, but there are few surgeons. Okay, so to cut down the maximum, which to prevent the cutting of the majority of the supraperiosteal arteries, they will be given the incision like this. Okay, but still, there are many surgeons. Okay, and it is actually the principle telling in your textbook also should be abused. Especially when you have a controversial question to answer, okay, whether you can go for an article reference or textbook reference, which helps means, okay, I will go with a textbook reference. That is what the examiner given the key actually from the textbook reference. Okay, so if you take a textbook reference, it is a correct. But horizontal incision in gingival sulcus for periodontally compromised teeth is not correct because for a periodontally compromised teeth, you should won't give the clavicular incision. You will be given the incision just away from the gingival sulcus, which is called as submarginal scalloped incision, otherwise called as Leuben-Coxine flap. Otherwise called as what? Leuben-Coxine flap. Okay, so this is obviously wrong. First statement is obviously wrong. Yes, Lena, correct. Okay, yes. So coming to the question number 5. Right, what is the answer to this? Okay, if there is a 7-year-old child, pulp exposed in a permanent molar, pulpotomy is performed. What is the material of choice? Yes. So, what is the key point here? The key point is the permanent molar. Is the key point here. Suppose if it is a primary molar, then you can think about primary molar. You can think about pharmacology. Okay, since it is a permanent molar, the preferable answer is MTA. Since MTA is not given, so I can go with the calcium hydroxide. Is students clear? Yes. So coming to the question number 5, obviously this is a very, very straightforward question. In a high-speed handpiece, which factor increases cutting efficiency? Obviously, if you give more pressure, its cutting efficiency is increased. Okay. Sharpness, if you increase cutting efficiency, is increased. It's not related to the cutting efficiencies. So obviously, which is the best option? So if you give more pressure, is that you may damage the underlying structure. Yes. So this is not a good option to give more pressure for more cutting. Obviously, if the speed of the burr is more, and if you have a good sharpness, obviously cutting is good. Okay, you cannot cut the wood with a blunt burr. Okay, so answer is what? Sharpness and rotation speed of the burr. Yes, students, clear is again one more very good question. Very good question. Non-vital teeth with open apex. What is the treatment of choice before obturation? Easy question. Anybody can answer. Since they're talking about non-vital open apex, okay, you just create a calcified barrier here before you do the obturation. So creating the calcified barrier is called as what? Creating a calcified barrier is called as apexification. Usually students will have confusion between apexification and apexogenesis. Students, please have a very clear-cut idea. Should have apexification is done for the non-vital teeth. Apexogenesis is for the vital teeth. Apexogenesis is for the vital teeth. Yes, sir. Okay, next question is soft fluctuant swelling with the necrotic mandibular molar. Okay, along with the pulpectomy, what should be done? So easy question. If there is soft fluctuant swelling, you should go for incision and drainage, right? Desensitivity treatment doesn't work when there is a swelling. Why? Pulp testing is not a good. Indirect pulp testing obviously is an irrational option. Yes. So you can go for incision and drainage. IOPA shows root surface with jagged margin, irregular margin, radiolucent area after trauma. What is the diagnosis? Okay. After trauma, resorption is very common. What type of resorption? Obviously, external resorption is very common after trauma. Internal resorption, which usually starts from the pulp and it go outside. External resorption start outside and go inside. That is the difference between the internal and external resorption. Is obviously the answer is external resorption. Yes, it's again very easy question, simple question. Calcium hydroxide placed inside the root canal by which instrument? Obviously, the laterospiral. Laterospiral is a rotary instrument. Okay, so simply to apply the sealer inside the root canal, we can use this laterospirals. Okay, all the others are shaping instruments. This correct order of the zone in the fish concept in the periradicular area. Okay, so this is the root. You have the first zone of infection. The second is called zone of contamination, zone of irritation, okay, zone of stimulation. Again, evergreen topic in your exam. Okay, what is the cell which is present in infection, contamination, irritation, stimulation? Can be asked in your INSET exam or your NEET 2027 exam also. Okay, show the infection, zone of infection which contains the neutrophils or polymorphonuclear nucleocytes. Soundarya Varshini Guter. So which of this is a natural scaffold in a regenerative endodontics? Okay, in a regenerative endodontics, so you will be using here two type of scaffold, one which is called natural synthetic. Okay, polylactic acid, polylactic glycolic acid, polyglycolic acids are called as synthetic scaffold. Hyaluronic acid, GAG, glycosaminoglycans, platelet-rich plasma, platelet-rich fibrin. All these are natural scaffolds in a regenerative endodontics. Dharmesh, very good. So next question. Obviously, an 8-year-old child has an Ellis class 2 fracture. What is the treatment of choice? For a Ellis class 1 and the class 2 fractures are called as uncomplicated fracture. Why it is called uncomplicated? Because the pulp is not involved. Okay, for a better aesthetic reason, will be given composite restoration. Okay, GEC is usually won't give. Yes, straightforward question. Stainless steel is from for the primary. During chemomechanical preparation, which area is called as the danger zone? Okay, so if it is a curved canal, students, if it is a curved canal, something like this, curved canal, okay, center you have the pulp, root canal, okay. So if you see the dentin in the inner curvature, you see the thickness of the dentin in the inner curvature is actually very less. Okay, so that is why this area is called as danger zone. Inner curvature of the curved root canal is called as danger zone. For a profound anesthesia in mandibular molar with irreversible pulpitis, usually the irreversible pulpitis cases need more local anesthesia. Does not respond to local anesthesia that much easily when compared to the vital teeth. Okay. So obviously you won't give topical anesthesia infiltration for a mandibular molar. For a mandibular molar, obviously need inferior alveolar nerve block. Suppose C also says inferior alveolar block, D also says inferior alveolar block, but which will be the better option? Since the question is about profound anesthesia, probably if you add intraligamentary to works, it's an adjuvant technique. Okay, adjuvant technique. Supplementary technique, intraligamentary, intrapulpal, okay, intraosseous. These are supplementary technique. Okay, 14th question you want to answer. 14th question answer is A. Inner curvature. This is this area. Inner curvature of the curved root canal, which is called as the danger zone. Sai, Harish, clear? Yes, sir. So question number 16. Okay. So trap question. Tricky question. Examiners wanted to lock you this question. Okay, many of the students which made this mistake in this question actually. Okay, the question is about hours to maxillary central incision 20 minutes ago. 20 minutes is a very good amount of time. When the patient brings the avulsion teeth within a 20 minutes of time, obviously you can do the reimplantation. Yes, but what is the key point here? The key point is 5-year-old child. Sticky point is a trap. Okay, so since it is a 5-year-old child, probably permanent central incision is not erupted. We're talking about primary teeth. Since they're talking about primary teeth, you need not to re-implant. Yes, if we just re-implant, it may cause us injury to the permanent tooth bed, obviously. So do not re-implant, but actually many of the students which made mistake, since actually is not seen the age of the patient. Okay, yes. So, student, these are all the endo questions, students. Almost how many questions? 16 questions only from the endo. I have not added the operative dentistry part of the questions here. Okay, I'm just going to discuss the operative dentistry part separately. Okay, again, a good number of questions. 16 from endo only. So, okay. So, is any doubt? Okay, we completed 3 subjects here. Any doubt here? Shall I move on to the next subject, students? Yes, so general medicine, general surgery. Okay. So give me 2 minutes time. Give me 2 minutes time. Okay. So we'll start the session. Okay, take a 2 minutes bio break. Yes, we go with the medicine discussion. We'll start with the first question. Right. So the question is about for a child who is a 6 week, okay, probably 1.5 months child, taken to the hospital for pneumococcal vaccination. The pediatrician wanted to give some conjugate vaccine. Okay, so what is the advantage of this vaccine over the older polysaccharide vaccine? It's a question, students. There are 2 types of vaccine which is available. One which is called as the polysaccharide vaccine. The second type which is called as the conjugate vaccine. Yes. So polysaccharide vaccine. which is usually indicated for when the child is a little age, I mean, probably 2 year like that. Okay, then I can go with it. Polysaccharide vaccine, right? So since the child is 1.5 year, 1.5 months, it's a 6 week. Okay, so I will go with it conjugate vaccine. So what is the answer for this? I will tell the answer first, then I will explain the question. Okay. So answer is this answer? Okay, they bypass the T cell immunity and act on the B cell and make IgA. Okay. Yes. Right. So usually is polysaccharide vaccine. Polysaccharide vaccine usually depends upon T cell activation. Polysaccharide vaccine which usually act on the T cell activation. T cell activation. But the conjugate vaccine, which does not do the T cell activation, it directly act on the B cell and produces antibodies. Okay. So conjugate vaccine usually will be given for the small children. Okay, because small children does not have good amount of the T cell. Students, the key point. Small children does not have the good amount of the T lymphocytes. Since they don't have a good amount of the T lymphocyte, I cannot give polysaccharide vaccine because polysaccharide vaccine, which actually do the process by activating the T cell. Since the children does not have small children does not have the T cell, I cannot give polysaccharide. So instead of I can give the conjugate vaccine. Yes, the conjugate vaccine bypass the T cell and it directly activates the T cell. Okay, students clear? Anybody doubt? Okay. Shall I move on to the next question? So what is this key point? What is the answer for this? Anyone? Okay, so patient is actually develops type 2 diabetes. Patient is having a type 2 diabetes. Overweight, BM is little higher. Okay, so this clinical characteristic image. So what is the diagnosis? Usually the dark color band present in the neck, which is called as acanthosis nigricans. Usually, if your doctor see the acanthosis nigricans in the neck, immediately he will actually tell you the warning of you are going for the insulin resistance. Be careful. Probably the doctor will ask you to take for the examination, blood sugar examination. Okay. So probably the patient may have developing the diabetes, or they already have diabetes but unknown diabetic. Okay, so acanthosis nigricans. Okay, nowadays actually you can see this type of pigmentation even in children. Okay, 10-year boy, 12 years boy. So if you see if the parents are just to see this type of acanthosis nigricans in children, 10 years or 12 years baby, immediately they have to take care and they have to reduce it for the obesity. Okay, so children's obesity, and obviously this is not the answer. Melasma usually seen in the pregnancy. Melasma usually seen in the pigmentation in the cheek in the pregnancy. Hemochromatosis usually has a bronze pigmentation. Hemochromatosis is a bronze pigmentation. Yes. So the answer is acanthosis nigricans. Yes. So coming to the again a lot of questions actually from the diabetes actually usually even if we take for a last 4 to 5 year paper, diabetes is a must know topic. Either at least the questions comes from the pharmacology or from the general surgery part, medicine part, you get some question related to the diabetes. Right. This is question the patient actually developed type 2 diabetes mellitus. Okay, patient developed the insulin resistance. Which of the following mechanism why it is happened insulin resistance in type 2 diabetes mellitus? There are two types of diabetes students, one which is called type 1 diabetes and type 2 diabetes. Okay, so which is actually autoimmune disease. Type 1 is called as the autoimmune disease. So there is a formation of autoantibodies. These autoantibodies are act against the beta cells and it actually breaks the beta cell. So since the beta cells are breaking, okay, the insulin is not produced. So that is why this insulin, this type of diabetes is called as insulin dependent diabetes mellitus. So antibodies against the islet of the pancreas, beta cells. is called as seen type 1. But here the question is about type 2. Okay, there is no relation between alpha cells and diabetes. Okay, obviously, what is happening in a type 2 diabetes mellitus? Peripheral insulin resistance. What is called a peripheral insulin resistance? Okay, so the cell is not taking the insulin. Insulin is not working on the cells. Okay, so cell is not responsive to the insulin. Okay, insulin that is called as the insulin resistance. Students clear? So answer is C. Answer is right. So coming back to this question is the question which is actually they show about the pigmentation. Pigmentation in the palate, pigmentation in the tongue. Yes. Can you see this? So what is the pigmentation? The pigmentation is actually related to what type of disease? The pigmentation, okay, usually hemochromatosis, you can see the pigmentation, but it is a bronze pigmentation. Okay. But again, there is a pigmentation you can see in the Addison disease. You cannot say pigmentation in Kaposi sarcoma and basal cell carcinoma. Kaposi sarcoma is more common in HIV patient, that is AIDS patient. So they eliminate the option. Basal cell carcinoma is not a basal cell carcinoma. Basal cell carcinoma is more common in the middle third of the face. Okay. Obviously, Addison disease is the answer. Why Addison disease is the answer? What is called Addison disease? Decreased cortisol. Decreased cortisol is called as Addison disease. Decreased cortisol is called as Addison disease. Whenever there is a decreased cortisol, as a feedback mechanism, there is an increased secretion of adrenocorticotropic hormone. This is adrenocorticotropic hormone which stimulates the melanocyte and produces the pigmentation. So that is responsible for the pigmentation like this. Students clear is Addison disease. One more key point actually, I just wanted to convey here. The patient also has less aldosterone. Okay, not only cortisol, the patient also has a less aldosterone in Addison disease. Aldosterone usually retains the sodium. Okay, since the aldosterone is decreased, sodium is lost in the urine. The patient has a less sodium. Since the patient has a less sodium, obviously they will craving for the salty foods. They will craving for the salty food. Okay, so that is one more key point you can take it, right? So answer is what? Answer is okay. This is actually one of the image-based question, not exactly the same image. Okay, but almost the images look like this. Okay, concept is same. Okay, you're not able to take the same image. Actually, I searched it, but not able to get the original image. Right, but the concept is same. Okay, image is almost close to the image what is given in the exam. Right. So see the image actually. Okay, leave the question. See the image. Okay, what is the image which says about? The image is saying about this is a unilateral. See this unilateral. Yes. Okay, so if you see any unilateral lesion, it is actually herpes zoster. Right. So among this, I can say which is the better option I can go for. Okay, obviously we are talking about. Okay, yes, usually which will go for the reactivation. Reactivation is more common, and obviously, what are the key points to run? The key point is chickenpox. Chickenpox, and the image which is both are matched. Okay, so reactivation of the latent herpes. Usually, the herpes, okay, even though sometimes the patient will recover, but the herpes will be stay in some areas, say latent virus. Latent virus means it does not produce any clinical feature. Okay, but it will stay mostly where it stays, it will stay in something called as DRG, dorsal root ganglia. Dorsal root ganglia. Whenever the patient immunity is coming down, okay, or if they are going for any stress, so this virus will go for activation. Activation and it will passes along the dermatome and it causes the lesion. So answer is what? Answer is A. The student clear? Okay. So this is again one of the very good question. Very, very good question. The patient, what are the key points? Smoker is the key point. weight loss, anorexia, okay, persistent cough, hemoptysis, clubbing, everything is a key point. Sure. Okay. So what is called anorexia? This patient doesn't have feel of taking the food, which is called as anorexia, right? Right. So since the patient has a weight loss, anorexia, persistent cough, hemoptysis, okay, I can think about tuberculosis. I can think about tuberculosis. But why not? But the answer is not tuberculosis. Why the tuberculosis is not the answer? Is clubbing. Usually not seen in the tuberculosis. Second is smoker. Smoker. Okay. Tuberculosis not necessary to be smoker. Okay. Third key point, 60-year. Okay. Usually tuberculosis is more common in young age. Okay. Adult age, not more than 60 years, right? So these are the key points. I am shifting the answer from tuberculosis to some other answer. Okay, pneumonia I can eliminate. Pneumonia I can eliminate because pneumonia usually fever are present. Fever is present in the pneumonia, so nowhere fever is present. Okay, given as a key point I can eliminate. Bronchiectasis I am eliminating because bronchiectasis is related to more sputum production. I can eliminate. Okay, I have two options now. Tuberculosis or bronchogenic carcinoma. This is the way you have to be practiced to eliminate the options one by one. Okay. If you master in eliminating the option, you became a master in your rank also. Right. So I can go for answer bronchogenic carcinoma students. Bronchogenic carcinoma is the answer. Why bronchogenic carcinoma? See a picture. There is a radio opaque lesion, coin shaped radio opaque lesion. Okay. So usually tuberculosis does not present this type of lesion. There's one more key point I can go further. Bronchogenic carcinoma. Clubbing is very common in bronchogenic carcinoma. Smoking is directly related to the carcinoma. So these are the points. I'm just going for the option C. Right? So students. So coming to the next point. Patient is actually has constricted people. What is constricted people is called? The constricted people is called the meiosis. That does not react to the line. Okay, yes. Constrict during the neonatal. There's a history of syphilis. What is the most likely diagnosis? You can leave all the key points. You just see this one key point, which is the syphilis. What is the type of people seen in the syphilis means? Arigil Robertson people, which is seen in the syphilis. What type of syphilis? Neurosyphilis. 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 There you have this Arigil Robertson people. How the peoples are look like? The people is irregular people. Up I can go for irregular people, right? Okay, but Harry Robertson people can irregular people is the feature, but you cannot directly go to the irregular people, right? So yes, so this is so easy question. And farmer people again, if meiosis is seen, okay, meiosis see as like here, but along with meiosis, you can also see ptosis and hydrosis. And hydrosis means loss of sweat. If these features are present, then you can go for the Horner people. Otherwise called as Horner syndrome. Horner people is nothing but meiosis and ptosis. Okay. It's called as the Horner people. Students clear? Yes, yes, yes. Come back to the next question. Okay, this is again a very good question. Actual picture is not needed. Okay. So there was a widening of the wrist. Okay, what is the age of the child? 2 years. Cup shaped defect. Bowing of legs. Delayed walking and bowing of legs. Bowing of legs is actually the feature of vitamin D deficiency. Bowing of legs is the feature of vitamin D deficiency. If there is a vitamin D deficiency, I can say either rickets or osteomalacia. I can eliminate these two options. Rickets or osteomalacia. Obviously, what is the age? Age is 2 years. Since it is a 2 year, they can go for what? They can go for rickets, right? Osteomalacia is seen in the old age. Okay, adult it is in this osteomalacia. What is the meaning of Malaysia? Malaysia means softening. Wherever you came across this Malaysia, it is called a softening. So osteomalacia means softening of the bone. Is Says, okay, good question. Next question. Okay, yes, it's a very good question, students. Actually, okay, actually, so patient is having a jaundice. Patient is having a jaundice, hepatomegaly, coastal margin. Okay, hepatomegaly under the coastal margin. So before extraction, I wanted to do some test. Which test I wanted to go if the patient is having some liver problem? Some liver problem. A very, very good question. Nice question. Okay, so the examiner wants you to know better application knowledge, okay, relating the medicine and the oral surgery. Integrated questions. There are a lot of integrated questions. Right. Which one I can go first, students? So anybody? Come on, come on, come on. Yes. I'm waiting for your answer. Yes. Bali says PTT. Bali says PTT. Shreya, PTT, Renuga. Okay. Says fourth option. Dharmi says fourth option. Very good, very good. Excellent. So students, very simple. Okay. If you know that what are the factors synthesized by liver, you can able to answer for this question. Okay. The factors which is synthesized by liver is primarily 2, 7, 9, 10. 2, 7, 9, 10. Factor 1 and 5. Which are the factors synthesized by liver. You know already 2, 7, 9, 10, which are called as vitamin K different clotting factors. Along with that, 1 and 5 is synthesized by liver. Okay, and mainly the 7, factor 7 is, these are involved in both intrinsic and extrinsic. Okay, mainly 7 is okay related to the extrinsic pathway. 7 is related to extrinsic pathway. If there is any problem in the extrinsic pathway, which test I should go for? Yes. Extrinsic pathway, the problem is present, which I can go for the PT, prothrombin time. What is the alternative for the prothrombin time? The alternative for the prothrombin time is INR. INR is the international normalized ratio, is the full form of INR. So how do you calculate the INR, students? INR is calculated by the PT of the patient by PT of the reference value. It is usually as a ratio. Okay, suppose PT of the patient and PT of the reference value both are same, obviously. So the PT is 1. It is a good ideal. Ideal is 1. For you and me, if you take a program in time, mostly we'll be having a 1. Okay. So based upon this, there will be alter the treatment plan. So answer is PTI. Albumin globulin ratio is not for the bleeding risk. Okay. I can evaluate. PTT is for intrinsic. ALT and AST is to check about the liver function test. I have wanted to see the bleeding. So I'm just eliminating this. Okay. Yes, students. Okay. So next question. Again, is same type of disease. Same type of disease. Easy question. Same, almost same. Easy. Anyone can answer. Patient has a problem with the hepatomegaly. Liver is affected. Since the liver is affected, okay, the patient have an increased risk of bleeding. Why? Because clotting factors are not there. Okay, so there is no clotting factors. Okay, only how come A? Okay, what is the relation between the bleeding and enzyme? Okay, yes. So it is about the clotting factors. If there is no clotting factors, liver is weak. So clotting factor is not produced by the liver. If I can go for B only, right? Students. So coming to the next part. Okay. So there is an ECG. Actually, I think the picture is not clear for online students. Okay. I draw the ECG again one more time. It's very easy, right? I hope we can able to see this image right now. Yes. Okay, the patient is taking uh, dual antiplatelet, dual antiplatelet, atorvastatin. Atorvastatin is the drug which is used for hypercholesterolemia. Okay, beta blocker. Okay, are now present with the disease. ECG shows complete heart blur. What will you do? Okay, so simple question. Actually, this ECG is given here to make you to panic. This question ECG is not needed actually. Okay, try to apply the concept and even in the question itself you can easily answer. Okay, whenever there is a change in the ECG, probably just think about whether the problem is in antiplatelet or atorvastatin. Beta blocker usually something related to block the sympathetic system. I told sympathetic system increase the heart rate. Sympathetic system increase the heart rate. A beta blocker decrease the heart rate. Beta blocker decrease the heart rate. Delays the heart pump. It slow down the heart. Whenever it slow down the heart, you can see the ECG change obviously. Okay. But atorvastatin or antiplatelet doesn't do anything with the contraction of the heart or speed of the heart. But beta blockers slow down the heart. Obviously, what is the answer? Okay. Decrease the beta blocker is the answer. Straightforward, easy. Actually, it is not a very difficult question at all. Okay, yes. Question number 12. What is the key point here? Okay, you need not to study any point here. Okay, one key point will just come to your eyes. Okay, and if you know already the answer, you can easily put. You don't need to waste time. It's all about red currant jelly sputum, which is seen in red currant jelly sputum, which is seen in Klebsiella pneumoniae. Yes, sir. So answer is A. What about Legionella? Legionella, the one question which is commonly asked in your NEET exam. Legionella is actually the organism which produces, which usually spread in air condition. Okay, so usually the whole question will be like this. A patient who attended some medical conference or dental conference, after he returning from the conference, he got a fever. Okay, all the symptoms will be given. If you get that type of question, then you can think about Legionella. What about Streptococcus pneumonia? Streptococcus pneumonia, which produces rusty sputum. Rusty sputum, which is seen in the Pasteur's Streptococcus pneumoniae. Haemophilus influenza. Whenever you see about this Haemophilus influenza, think about two important points. It causes chancroid. Causes chancroid. And it causes an appearance. Haemophilus influenza, what is the appearance? The appearance is school of fish appearance. Yes, sir. So come back to this question. This is the question is about red currant jelly sputum. So answer is Klebsiella pneumoniae. Yes. So coming to the question number 13, students, is so easy question. So patient is having the routine examination, shows anemia. Okay, decreased ferritin. What is called ferritin? Storage form of the iron is called as the ferritin. Decreased serum iron. Iron is less. Iron is less. Storage form is less. But iron binding capacity is increased. Transfer is increased. Two things are decreased, two things are increased. Okay. Whenever the total iron binding capacity is increased, what is this anemia? Total iron binding capacity is increased. It is called as iron deficiency anemia. Straightforward, easy question. Okay, so iron deficiency anemia usually has less serum iron, less ferritin, increased total iron binding capacity, increased transfer. This is clear. So, what is the inclusion body seen in the cerebroplastic anemia? Commonly asked the NEET question. Okay, what is the inclusion bodies? Pap and female bodies. Pap and female bodies seen in the cerebroplastic anemia. What is the meaning of TIBC? Total iron binding capacity. Okay, total iron binding capacity. What is total iron binding capacity? Okay, suppose if you are not eating anything for 3 days, okay, not eating anything for 3 days. After 3 days, someone giving you the idli which you got from your own canteen. Okay, whether you will eat fast or slow. Okay, once you see the idli, you will eat fast, right? So like that, because the patient is having iron deficiency, iron binding capacity will be faster. It will take more iron. So that's called TIBs, total ion binding capacity. Dharmesh, you got it? Okay. So yes, students, these are all about your medicine question. Almost 13 questions from GA. That is about general medicine. Yes, sir. Students, any doubt in this? Very good. Sri Vashmi, thank you. Okay. So, student, please give me 2 minutes break for me. I just wanted to check whether they given the pictures. I mean, my team added the pictures or not. Okay, in the microbiology part. Okay, I'll be checking and get back to you. For any doubt, you can put in the chat box. Yamini, thank you. Bashini, thank you. Yes, KP, yes, put up. So please go. Okay, so now I'll be given this recording for you. Okay, give me some time. We'll be given the recording, so you can go through your free time for your revision also. Okay. Yes, very good. Thank you, students. Okay, and here we complete the part one discussion. We go for the part two discussion by tomorrow. Okay. So thank you all the best. Do well. I just wanted to the 2027 batch students are allowed to stay there. Okay. 27. If any 2027 students are there, actually stay there. Okay. Students preparing for 2027. Okay. So what is the take home message by go through this 2026 paper and 25 paper? Okay. Both are almost the same type of question. Both are almost both are almost the same type of question. The trending is mostly decreased memory based question and more of concept based question, analyzing based questions are there actually. With or without image, not a problem. Okay, so how you can increase your analyzing power is by doing only one thing, revision. Revision. Okay. So by doing the pulse, okay, by doing the preparation of the pulse of the one time, you will able to understand the concept by over 50 to 60 percentage. Is doing the same pulse if you do the second time. Okay, the same pulse, same page, same thing, same question. But when you do the second time, your understanding of that particular concept will be deeper, probably 70 to 75%. Third time and the fourth time when you go for, the understanding will be still more better. Only the understanding is better, you can apply this concept in the exams. If your understanding is not good, if you read only one time, probably your application knowledge is very, very less. Okay. So, if you are a student who is preparing for 2027, start your preparation as the earliest students, as the earliest. Okay. Try to complete by November. Okay. So, even in our attendance, we have the plan of to complete by November. Every year we are doing this only. Okay, after November, we have December, January, February, March, April. This 5 months for exclusive revision, almost 150 days. Okay, that means not like complete the 19 subject and revision is starting by November, December, not like that. Okay, it's like revision is happening in between itself. So when you complete the first subject, when you go for the second subject, you have to read the first subject then and then when you have time. Even our monthly test will be like this only. Your monthly test is like so we'll be having all the four subject, whatever the subject I'm taking all the 4 weeks, you will be having on the monthly test in the NEET pattern. When you go for the second month, the second month or monthly test is having the test on first month and second month both. Second month, third month you have all the 3 months subject. So this is will be like a cumulative part. So only if you read this, your retaining power will be good actually. Okay, and after you completed your portion, exclusive revision you are going to do. Okay, after November, very good amount of time. So this is the way actually we are doing in on attendance. If you are a student preparing for 2027, okay, I'm advised the same plan for you. Go for a multiple position students. That is a key for today paper success. Okay, 27 paper success. Okay, do well, all the best. We'll meet you again by tomorrow. Okay, probably I will fix the time and tell you back. Okay, So put in the messages in the group which you belong to. All the best, students. Take care. Bye. See you. Thank you. Okay. Dharmesh, Akshila.